All right. Well, good afternoon again. For those of you that weren't here for part one, you missed out. But now we're in part two of supporting the author journey here at BMJ Group. And it's really about, okay, so now that you've been published, what happens next, right? And a couple of years ago, I was at a conference and I was hearing an author. He came to our booth and he was talking to my colleague and I, and he was talking about like getting published, and then oftentimes, you know, you get published and you move on to the next, right? Like you might get some updates on where your article's being cited, but like you're on to another project. And he's like, but that's really where the fun begins once you get published, because he'll get invited to conferences, you know, he'll get invited to maybe write a book chapter onto something else to expand a little bit more. So there's a lot of stuff that happens after you get published that oftentimes we don't know what to do. So if you were here in part one, you know that we have the BMJ Author Hub. It is a completely free resource that has been put together by BMJ's editorial team. And there's a section there on promoting your paper, right? How to get the most views, how to get the most citations, how to get invited to conferences. There's sections there on sprucing up, like if you want to create video abstracts, and it gives you like literally guides on where to put the camera and like all this information that is really, really great, that really helps support, okay, now you've published, the work continues a little bit more, right? It's great that you got published, but there's more that you can do. So free resource, authors.bmj.com. But, you know, when we talk about impact, I have a question for the group. What comes to mind? Any words when you say impact? Research impact.
H-index.
H-index. Yeah?
I was going to say policy,
Yeah,
shaping policy,
okay, yeah.
Practitioners in the field,
Yeah,
applying
yeah.
research.
Does impact factor come to mind also maybe? A little bit, sometimes, if you get published in the BMJ. Number 3, by the way. So last year at the Charleston conference, we had a session talking about impact beyond the impact factor, right? And we had Donna Gibson, she was a medical librarian director at Sloan Kettering, and we had 2 researchers join our group and talk about what impact really meant for us. And what's on the screen right now is not just the map of the world, but with little dots everywhere, right? But this is a particular institution. The amount of articles, over 12,000, that have been cited in over 80 countries around the world in their policy documents and clinical guidelines. So this one institution, all their research output, regardless of the publisher, if it got cited in health policy, in clinical guidelines, and even at the point of care with BMJ best practice, will get captured in BMJ Impact Analytics. And this was one of the tools that we talked about in that session last year was, you know, what did impact mean? What does it mean for you as a researcher? What does it mean for you as a medical library director? What does it mean for you as an editor-in-chief of a journal? And they all had different answers, of course, but there was some familiarity and some synergy between the answers as well. And that is, what do you do once you get published, and why do you do it, right? What's the reason behind it? It's hopefully to change something, to bring awareness to something, to do something about it, right? And when we talk about this tool, BMJ Impact Analytics, it's really the only tool that really focuses in on where your research at your institution or from any one of your authors is being cited in health policy documents and clinical guidelines. But to give a little bit some perspective on what does that mean. So less than 6% of academic research gets referenced in policy. So very little actually gets referenced. And on top of that, it takes quite a long time sometimes to get referenced in policy, years later. One of the researchers that was there, he had worked about 5 years ago at Johns Hopkins. He's now at an institution down in Florida. But he published an article, I think it was in 2015 or 2016, and it was around HIV, and it was about some medication, and you know, it was 8 years have passed since he published. And then I asked him, I'm like, have you looked at what the impact of that work has done? He's like, oh, I'll get emails sometimes about where it's being cited. And I was like, did you know that it was cited in the CDC and the World Health Organization? And his eyes immediately opened wide and his jaw dropped. He had no idea, and he literally said, I just made his year. But sometimes it literally takes that long, 5 to 10 years for published research to be cited in policy. Now, there are some caveats to it, right? During COVID, there were preprints that were actually being cited in policy, right? Like all those changes of like 6 feet apart, wear a mask, don't wear a mask, be outside. That was all published. That came from something, and then it was cited in policy that impacted and infected all of us, right? So that's why when we're talking about measuring impact, specifically when it comes to healthcare and medicine, right? We're BMJ, so that's what we're known for. We're looking at where your work is actually being cited in those health policy documents, in those clinical guidelines, and at that critical point of making a clinical decision at the point of care in BMJ best practice, because we're even showing you where your research is being cited in BMJ best practice topics. If you're not familiar with BMJ best practice, might be someone from this morning's session, you got a little information about it. It is a point of care tool that BMJ has. It's been out for over 15 years. It's a global tool, global product used all around the world, specifically for the use at the point of care. So BMJ Impact Analytics, has anybody heard of the tool thus far? Yeah? So you've heard, maybe attended some awesome stuff. So it's a brand new tool, about 1.5 years old, and it specifically was created in partnership with Overton, right, to focus specifically on health policy and clinical guidelines and in point of care. It's the only tool of its kind that goes in depth specifically for these health policy documents all over the world. When it launched about 1.5 years ago, I think there were about 8 million documents that it measured and tracked. It's now over 12 million, just 1.5 years. So expansive growth. But it's the most up-to-date and comprehensive tool that you can use to track and share the real-world impact of your medical and health research. And when, it launched about 1.5 years ago, so we have different customer types and how they're using it. And this is where I want you to think about how can it be useful for you at your institution, at your organization, to help support your researchers as well. Right? Because there's institutions that are looking at it to identify, okay, where's the funding coming from? Because it does allow you to do that as well. Institutions that want to evaluate the success of read and publish or transformative agreements. They want to okay, are we having an impact on the open access articles that we have published to these agreements, right? Are these being referenced and cited in policy, right? Because we've removed the barrier to read it, but what else is that research doing? We have institutions that are using it to boost their researchers and their authors, to give them more information on the impact of their research. Because I will say, when I speak to authors and I pop in their name in Impact Analytics, they're often so completely surprised because they know they're being cited, but they just don't know where specifically. And they don't know that this one research project that they did in Sao Paulo in Brazil is being referenced in Swedish policy documents, right? So it goes beyond the work that they've done locally. It's pretty fascinating. So there's many different use cases that the tool has been used and is currently being used. But I was curious to see, okay, how does this look like for me? I'm not a researcher, right? I'm not an author, but how can I put this into context? And what are some of the things that we use now to measure one's impact, right? And there's many tools and there's many metrics and there's many points of data that we can utilize to say, okay, yeah, that's impact right there. And there's quite a couple of things that you can see from this particular article. And when we talk about impact, it can be a combination of all these things. And I do think it is a combination of all these things, actually. I think it's looking at the whole life of the article, all the colors that life brings to this article. So this article was published in the BMJ. Congratulations to the authors here because they're part of the 3% that get published in the BMJ. It was published about 20 years ago. And then on any of our article sites on our and in our journals platform, you can see article metrics, right? It's already included. You can go directly to the article and you can see, okay, how many downloads does the article have? If it gets mentioned right on social media, right, it will have an altmetric score, which is pretty nice to see that, right? What's the social impact of your work? So these are all measures. If you think about when you talk about impact, number one, getting published in the BMJ, that's a feat in itself. And I think a 96.3 impact factor, that is pretty impressive. Look how many downloads since 2018 this article has had. 81,000 abstract views, 18,000 PDF, right, downloads, 5,900 HTML views. And then if you take a look at the altmetric score, 133, that's pretty high. That's pretty significant with this particular article. It's in the top 5% of all research outputs scored by altmetric. That's fantastic. You can see all the different, where it's being mentioned in news outlets and blogs. There's this one right here, policy sources, 9 policy sources. And then that had me thinking, I'm like, oh, so yeah, so it is. It's also being referenced in policy and it's being captured here. Let me pop in the DOI of this article, they did this yesterday, into Impact Analytics. So as you can see here in the search navigation, you can search by institution, you can search by author name, you can put in an ORCID ID, you can, many different ways in which you can search, right, to see your research output. I just put in that one DOI. You can put thousands of DOIs in there and see the results of all the impact of your research, specifically, right, in health policy and clinical guidelines. But you can see one article came out here, but you can see that has over 1,000 citations in 138 different sources impacting policy in 30 different countries around the world. And some of I mean, it's a little like messy over here, but the AHRQ, you can see the CDC here, the World Health Organization. I mean, different governments all over the world. I mean, it's pretty impressive, you know, when you measure all this that we have available, and there are other tools out there as well, but then when you go and zero into health policy and clinical guidelines, it is pretty impressive. It tells an even deeper picture over here as well. And I think it is a combination of all these things when we talk about measuring impact, right? What has your work done that you have to take all this into account? My colleague Becky is here. I love statistics. It's like my thing. I jump in there. I love telling story with data, but going in here and telling these stories when I meet with our customers, when I meet with researchers, it's awesome for them to see. And that's just impacting health policy and clinical guidelines. But I mentioned that it's also being cited and referenced in BMJ Best Practice, which is our point of care tool. It's used all over the world. The NHS uses it, right? It's their clinical decision support tool. And BMJ Impact Analytics does track your research that's also being cited in BMJ Best Practice. And then it takes you back to the actual topic. So this research impacted and was cited in hepatitis D topic. And again, this topic was viewed all over the world 1,300 times last year. So you're talking about a doctor that's going into this tool to properly either diagnose or properly treat a patient, and they're using your research to do that. That's the impact that you're having literally at the bedside, and it's really, really great to see this. Any questions? Yes?
Don't hate you for the question.
No, no.
So
Hey,
there's
no.
and I kind of say this there, there's so much AI stuff, but like there's this stuff happening where authors are not saying that's happening here. Who knows where it's happening, but in the news, they're saying some people are using AI to like get fake citations. Like, how is there anything in here that like helps track if that's happening, or is that like popped up as a problem? Like maybe it's not a problem, just if that's like a thing.
Maybe. I mean, I do think so. Were you here for part one?
No, sorry.
Okay. So we have the AI policy, and we go very in depth in what you can and can't do, what you need to disclose and not. I'm sure there's quality checks along the way before something gets published, but there retractions happen all the time, right? Good question. I don't know the answer, but I can try to find out.
Yeah, it's just a curiosity.
Yeah. I mean, it is a big theme, especially this year at the conference, right? So, good question. Yeah.
I have 2 questions, but I'll go just one since I see other hands. The first one's kind of related to that. Since article abstracts are freely available online and typically scraped by large language models, is that also going to be happening with the video abstracts? Could people's recordings of their audios and faces be at risk of being abused? Like, that's true all the time. And but I mean, is there anything that BMJ is doing to help protect that? So I love the idea of a video abstract. I just talked to a faculty member earlier who said, no, I won't have my face on there. So this is coming up as an issue, just for you all to know.
I'm going to write that down because I don't know the answer to that. I'm not in the editorial team, but I'm sure that would be somebody, our head of ethical research and content integrity would love that. Any other questions? In which I may or may not be able to answer.
Okay. I don't work in this specific sector of scholarly publishing, so this is all new to me. Forgive me if it's naive. So Overton, I mean, you partnered on this.
Mhm.
Presumably Overton partners with lots of other publishers on the same kinds of tools? Or is this like an exclusive collaboration? I'm just curious. Do you have any
I
idea?
don't know if Overton has other collaborations, but this
Okay.
was.
I guess where I was really going with this was a broader question. This seems to be an opportunity. Well, first of all, open access. I would be curious as to as time goes by, if we can see whether the articles that happen to be published open access are more swiftly cited in policy. If all of this then really this would be like proof
Yeah.
that yes, we are actually speeding up the whole process. And I'm
Yeah.
just curious if
No, that's a
We've
good
been
point.
thinking
That's a good point.
about
And you can see, right, years of publication within the tool. So there's filters that are built in. You can focus in on what's hybrid, what's open access, what's controlled. So you can do all of that, and
Okay.
I'm sure with your own analyses,
you can add.
pop it into an Excel
Yeah.
and like kind of see like how long it takes. Like this article that I mentioned here is 20 years old.
Right.
It was picked up in policy like a year ago in 2023. So it's still being picked up, even if it's 20 years old.
But that's a
But
really good point, though. If an article is open, does it get there faster?
Right,
So,
that's the ultimate
yeah,
question.
so I think that's a great idea for like a white paper or something. Like, that's a
Yeah.
really good idea.
Maybe it's early yet to assess that. I
Right.
mean, but
I'm gonna ask the product manager of Impact Analytics to see if if that's being thought about, and to see if there's something that we could like facilitate that kind of analysis. Yeah, I don't know.
that's a good.
It is a really good question. I'd like to know myself, so yes.